was working with a nationwide healthcare company who had over 20,000 employees. Now, two particular teams. Each of those teams had a staff about 12 to 15, and they were having difficulties in working together. The dynamics between the two teams had become disrupted and counterproductive. Many had almost checked out. So as part of a kind of reset or recalibrate, the group leader brought me in to help rebuild the team. In our initial discussions, we talked about communication breakdowns, the lack of trust, and dynamics of each team. We discussed how it would require the team members to be vulnerable and uncomfortable to work through this. It wasn't going to be an easy journey, and we'd have to address the root causes, like lack of trust, lack of awareness of different styles, and then slowly rebuild. We spent a couple of months preparing for this intervention that would involve tough conversations, team building exercises, and some training on leadership and communication skills. The group decided to work through the Berkman method, which is a personality and leadership assessment. And we started with building an awareness, an understanding, and value of what each team member brought to the table. And as both groups worked through many exercises and hard discussions, it was amazing to see the aha moments and the light bulbs go off. The two groups started to focus on the bridges to overcome the barriers that they had put in place. It wasn't an easy exercise, but in the end, the teams were able to use these differences in personality and styles to their advantage. It was amazing to see it working and amazing to see how they leveraged these differences for the good of the team and the work. Now, these differences were out in the open and encouraged rather than shunned. The groups walked away with a common framework and language that they could use when navigating conflict, change, or in their daily interactions with one another.